We absolutely don't. No one's looking for shortcuts. Like I think we absolutely have to maintain the integrity of the process. I also think it's important to consider the possibility of both process improvement and sort of tailoring assessment to individual family and community needs, sort of in an effort to kind of create that more equitable process. And I do think it's worth acknowledging that we do have this workforce problem that both locally and certainly globally, like the number of specialists to go around doesn't quite match the number of individuals and families that need to be served. So from my perspective, there are a few important considerations that begin to like help me think about how we're going to start to tackle this. But I want to say that I think it's important for all of us to feel really uncomfortable about the inequitable access that families and individuals are currently experiencing. And by no means are we anywhere close to kind of resolving these issues. So the first point is that I do think this discussion around best practice is really healthy, kind of keeping in mind sort of what the goals of assessment are. And as Summer, as you said, it's never testing for testing's sake. It's a valid and an accurate diagnosis, a holistic understanding of the individual and their needs, and then sort of the process piece around compassionate sharing of feedback and making sure that people are on the right track in terms of accessing services. If we think about it that way, and we think about the diversity of individuals and families that we serve, I think it's possible to think that gold standard might be what's needed to achieve best practice in a particular situation, like for a particular individual and family. And that may not always look the same. So the measures that we're using, the length of assessment, the number of individuals involved may actually vary across sort of those clinical needs. And I think it's possible to think about multiple pathways to assessment that respect the integrity of the process. And recognize that there may genuinely need to be different levels of assessment to inform expert clinical judgment, depending on sort of what the questions are and what the issues are. A social worker colleague of mine, sort of oriented me to this concept of asset-based community development. So if we think globally, I think we're learning about kind of co-design when it comes to individuals and equity-seeking groups, but I think we can think about it at the community level as well. Like I think fundamentally, in trying to provide equitable access globally, to actually kind of empower the community to sort of take stock of like the local champions, the available expertise, sort of what's working well and where the gaps are, and to really think about how to establish partnerships between sort of like community professionals and people working in specialty practice, and kind of tailor the approach to sort of what the individuals in the community, the existing sort of infrastructure and expertise, and think about how to make this work. So a very small example that for me is I've been fortunate to kind of do some outreach work to Northern Alberta, sort of like in the area of the country that I work in. And I can't take any credit for this model. This is an old colleague of Kathy's, Keith Golden, who's a developmental pediatrician who worked there for a number of years. And the strength in that community actually came from within the school system. So I have the easy job of working with the system where the school actually does all the heavy lifting around working with the local pediatricians, ensuring that there's appropriate monitoring and surveillance for features of autism. The school actually brings the kids and families in. The educators and the therapists are present for assessment. I kind of patch in to kind of do some assessment, and then the school personnel actually do a lot of the heavy lifting around supporting the family post-diagnosis and helping them navigate the service system. So I'm still sort of bringing in some knowledge around diagnostic assessment, but frankly, the amount of time and feeling like that I'm working in isolation and having to carry sort of all that responsibility is less. And frankly, it allows me to actually work with more kids and families. So it's not sort of delegating the full responsibility to generalists or people that don't have particular training in autism, but it is kind of for me an example of a partnership. And then to end quickly, I mean, Val, you alluded to sort of how ECHO is like this, sort of really exemplifies this idea of a community of practice and partnership. And I think ECHO is a great example of this concept of a learning health system. And this notion that sometimes effective systems of care are kind of works in progress, and that we can kind of refine and improve the work that we do through an ongoing process of like trying things out, evaluating how they're going, and sort of kind of collaborating with partners. Like the idea that the spirit of ECHO is really sometimes the airplane needs to take off before we finish building it. And that can be okay. And I think if we're going to tackle these really complicated issues of access, I think we need to just get started. We need to sort of build from community assets and strengths, think about how we can layer in some supports and expertise, and let's like continue to grapple with building capacity, even where it seems like there's huge barriers.